Hello, Assalamu alaikum. Ultra Scan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right and upper right and upper left implants, and the lower right and lower left implants, and the bone surrounding them. Now, on the panoramic view, we can very clearly see that these implants have been placed quite significantly. On the transaxial view, which is basically the proximal view, we can very clearly show you this is the proximal implant. This is the implant in the upper right premolar region. You can very clearly see that this implant has been placed, has good bone support on the parietal aspect and very little bone support on the buccal aspect, even though we won't categorize this as bone dehiscence because we do see a little bit of shadow of bone, then this could be grafted bone. Moving to the lower right segment of the implant is placed quite um, in a very good position because we got good healthy bone on the buccal aspect, good cortical bone around the crest of the implant, and good cortical bone on the lingual aspect as well. Moving to the upper left segment, this is the upper left segment. This is the first implant, the second premolar region. There we go. So this implant again has bone support on the parietal side, but has significant bone loss on the buccal as well as on the crestal area of the stool. When we move on to the molar implant, this implant seems to be placed after sinus grafting. As you can very clearly see that this implant has sinus grafting there. It's center of the ridge and has good bone support around the crest. This is the distal most implant on the upper 7. Again, placed at an angle where it has very good bone support and the good bone quality around the crest of the implant. When we focus on the lower left implants again are placed center of the ridge. However, we do see a little bit of crestal bone loss, but good bone support overall. And when we look at the implant in the sixth region, again the ridge is staying with the implant has insignificant bone support in the around the crest, but good bone support around the middle to apical third. These are the implants. When you look at the implants axially, which is the top to bottom view, and these are the bottom implants when you look at the teeth from an axial point of view. There we can see that there is good bone support in the middle to inferior. This implant has good bone support around the crest, whereas these implants have slightly less bone support around the crestal region. So if you have further questions, please feel free to reach to our team. Thank you very much.